This is Dr. Martorell, infectious disease. The topic will be COVID-19. COVID-19 stands for Coronavirus Disease 2019. It is caused by a virus, the SARS-CoV-2. It first appeared in late 2019 and it has spread around the world. There are different variants or strains of the virus that causes COVID-19. Some variants seem to spread easier than the original virus strain. Certain variants may make people sicker than others. In the United States, most cases of COVID-19 are from the Omicron variant. The virus that causes COVID-19 mainly spreads from person to person. This usually happens when a person who has the infection coughs, sneezes, or talks near other people. A person can be infected and spread the virus to others even when they have no symptoms. Symptoms usually start 3 to 5 days after the exposure and the infection. In some people, it can take up to 2 weeks for the symptoms to appear. Some people never show symptoms. Some of the symptoms may include fever, cough, shortness of breath or trouble breathing, feeling tired, fatigued, shaking chills, sweats, muscle aches, headaches, sore throat, runny nose, stuffy nose, problems with senses or taste. Many people have mild symptoms. Some people may have digestive symptoms like nausea or diarrhea or vomiting. Some people may develop skin rashes. For most people, symptoms will get better within a few days or a few weeks. A small number of people get very sick. In severe cases, they may end up in the hospital with respiratory trouble, and their organs can stop working and some people can die. Some people with COVID-19 may have persistent symptoms for weeks or months. These symptoms can happen in people who are mildly ill or in people who are severely ill. The risk for getting seriously ill depends on the person's age, the person's health, and whether the person has been vaccinated or not. In some people, COVID-19 may cause disease such as pneumonia, which can lead to respiratory failure and death. It can also lead to cardiac problems. The risk gets higher as people get older, and the risk is higher if people have diseases such as diabetes, cardiac disease, renal insufficiency, HIV, diabetes, pulmonary diseases like COPD, sickle cell disease, obesity, and others. People with a weak immune system like HIV or on certain medications or asthma, cystic fibrosis, type 1 diabetes, or high blood pressure are also at higher risk of serious disease or complications. Getting vaccinated makes people much less likely to get seriously ill with COVID-19. There is a test to detect COVID-19. It could be a nasal swab or an oral swab. Some tests may use saliva samples. Usually there is 2 types of testing, molecular testing and antigen tests. The molecular tests looks for specific genetic material from the virus. They are nucleic acid tests or PCR tests. These can be done in the doctor's office. The molecular tests are the best way to know if the person has COVID-19, and that is because they can detect even low levels of virus in the person's body. Antigen tests will look for proteins from the virus. They are usually faster in terms of getting results than the molecular tests. They can be used at home and at the doctor's office. Molecular tests are more accurate than antigen tests. If a test is negative and the person has symptoms consistent with COVID-19, the test should be repeated. It could be done a day later or a few days later. There is also a blood test that can show if the person has had COVID-19 in the past. It is an antibody test. They are not used to make an acute diagnosis of COVID-19. If the person develops COVID-19 infection, they should stay home, rest, isolate themselves, drink plenty of fluids. They can take medications like acetaminophen for the malaise and fever and aches. Also, ibuprofen or similar medications may be helpful. If you go out, you should wear a mask. You should go back to work or school or elsewhere when the fever has been gone for 24 hours or more. If the breathing symptoms get worse, you may need to contact your doctor or go to the hospital. Treatment may be needed depending on the person's age, health, and symptoms. Most people with COVID-19 with mild symptoms do not need treatment. Doctors do recommend treatment with medication for people who are at risk of getting seriously ill. Those are people that are 65 years old or older, adults with certain medical conditions like people with weak immune systems, diabetes, renal dysfunction, serious heart or lung disease, chronic kidney disease, obesity, and others. Any adult that is 50 that has not been vaccinated should also be treated. Discuss treatment options with your medical provider. For people who need treatment for mild COVID-19, they can use Paxlovid. This medication can lower the risk of getting sicker. Paxlovid comes as several pills that you can take for 5 days, and they should be started as soon as the symptoms start. This medication will need to be discussed with the doctor to make sure that the person is a candidate for treatment, and also review any contraindications or medication interactions. Some people who get treated with Paxlovid may get a viral rebound. That means that they may test negative for COVID-19 and then test positive again. Some symptoms might come back. The benefits of treatment are higher than the risk of viral rebound. People who cannot take Paxlovid, another option includes remdesivir. It can be given IV or intravenous, molnupiravir, convalescent plasma. If the person is having trouble breathing or low oxygen levels, they will need to be in the hospital and they will need treatment while in the hospital. The best way to prevent COVID-19 is to get vaccinated. There has been different vaccines for the different strains over time. Other things to protect yourself includes washing of your hands, wearing a face mask. Masks can help protect both the person who's wearing the mask and people around them. Stay home when you are sick or self-isolation. Try to avoid contact with other people. Cover your mouth and nose with the inside of the elbow. If someone is sick in the home, regularly clean things that are touched a lot. That includes counters, bedside tables, doorknobs, computers, phones, and bathroom surfaces. Make sure there is good ventilation or airflow in the home. Open windows to let fresh air in. I hope this information was helpful. Please like my social media pages. Thank you.